Health Check is proudly brought to you by First Capital Bank. Belief comes first.
All right, morning, Dr. B.
Bright and early. Good morning. How are you?
I'm fabulous. How are you doing?
How's your voice kicking?
My voice is doing so amazing, Dr. B. I've got gigs after gigs after gigs.
You know the word mellifluous?
No, actually, I don't.
Mellifluous means you sound like an angel.
Ah, Dr. B, thank you. Thank you so much. Can I tell you something before we start? Millie, Lala, and I were talking about how we have loved you since working with Millie, and now that you're with me, we just feel like your voice is so calming. All the bad things that you told us we were doing, we changed them, and look at us now. I'm skinny, Lala's happy, Millie's thriving. So we just wanted to give you a big shout out.
Oh, big hugs to all of you. I think
Yes.
you've demonstrated that it's not about a diet, it's about a lifestyle.
Of course it is. So yeah, take it away for us, Dr. B.
Well, talking about angels, we're going to be talking about something that's a pretty sensitive subject, but it's something that needs to be talked about and not often talked about, and that is really end-of-life care. And you know, it's a big topic. Everybody should know somebody that's died or is dying or is close to dying, and I think it's a whole specialty in medicine which we call palliative care medicine, which is now coming into its own because we're beginning to understand what the consequences of end-of-life care are, what should be done, and how it should be done. And I think, you know, this is an important subject for everybody to understand, and it includes, you know, the physical, emotional, social, and I guess spiritual support for patients and their families. For, you know, the goal of end-of-life care is to control foremost, Zoo, is to control pain and other symptoms so the patient can be as comfortable as possible. And, you know, gone are the days, and certainly in my younger years, we used to absolutely forbid the use of excessive morphine or codeine, only to realize that this is being very silly. If somebody's in pain and they're dying, they can hardly be worried about addiction. And so, you know, the things about pain control are really important. You don't want somebody to be miserable and in a lot of pain when they're dying. So end-of-life care includes sort of palliative care, supportive care, and in our country what we call hospice care. So it's really, really important to understand and discuss with the family, with the patient, end-of-life approaches. You know, how do they want, what care do they want, you know, what assessment do they want, within the family, who's going to coordinate the care, who's the caregiver. Also, never forget, Zoo, and it's what I find, that nobody cares for the caregiver. You know, if it's the daughter looking after the mother or the son looking after the grandfather, you know, who's caring for the son? Because
That's very true, yeah.
The caregiver themselves are going through a lot of stress, you know, maybe changing nappies, changing bed sheets, getting medicines, transporting to the hospital, and they can also become exhausted, and nobody often asks them, how are you doing? You know, so coordination of care, and where possible, Zoo, it's really important to try and ensure where within the circumstances that high care is given within the home of the individual. It is very rare for an end-of-life patient to want to end their life in a hospital. They want the last days of care to be with family, and whether it's a few months or even up to a year, people in lots of different situations benefit from actually having their family around, touch, talk, you know, presence in the last days of life. So this is really important thing to understand in terms of end-of-life care. So discuss with the patient exactly what it is. And for example, with end-of-life care, you need to talk about the medication. It's no good to be cowboyish. You know, if somebody is end of life, there's no point in taking some of the medicines they're taking for, whether it's, you know, for gout or whether it's for heartburn, because they're not going to be worried about those sort of things, you know.
No.
So, you know, move away some of the tablets that are really not necessary in terms of giving them a good quality of end of life. So medication, nutritional changes, you know, as the patient is coming to the end of their life, nutrition is not as important, but you need to try and make sure that they actually are in a good state in terms of hydration, in terms of a little bit of nutrition. So discuss these things with your doctor or your nurse or the hospital in terms of what needs to be done at home. And then, of course, relaxation techniques. Some people, you know, some patients are in pain, they need massage, they need even a hot water bottle. These things are really important, and foremost to my mind, having been in this business for 38 years, is emotional and spiritual support. I cannot emphasize enough that care of the dying, they want their family, they want people around them, they want people to talk to them, to touch them, to console them, and to hold them sometimes. So support is very important. And of course, like I said, support for the caregivers as well as the children around them is really important. So this is what is end of life or comfort care, you like.
Well, I mean, we experienced that. I wanted to mention it because obviously, like I said, I knew you. Oh, wow. Because I knew you through my grandparents, and my grandfather was somebody who suffered with cancer many a time. So we definitely did that. His last days were at home in Moshopa with his wife and his daughter and my brother, who we always try to make sure he's okay because he is sort of like the hero, because him and his friend used to drive my granddad to the hospital and back, hug him, feed him, like you're saying, spiritual things. And I just wanted to know the guidelines on how to manage this so that, every other family knows how to take care of somebody who's passing.
Well, I think that you need to discuss with them exactly what they want. And often before this sort of stage arrives, the discussion should already have been initiated with the patient and with the family so that they are prepared. The worst thing that a doctor or a hospital can do is to suddenly spring it upon the family that, unfortunately, your loved one is about to die or is going through the throes of the end of life. And then so it becomes a highly anxious affair if the family is not prepared for it. There are obviously situations where, it occurs unexpectedly. So discussion and conversation really needs to occur. And I know, we in the health sector are often very, very busy, but make sure you take time to sit with the doctor or the nurse or the hospital and say, I need to understand exactly what stage it is that my mum or my dad or whatever it is. And the signs, if you like, that death is weeks away is the patient begins to sleep more often for longer periods. They'll start to refuse foods that are difficult to eat, or even refuse all solid foods. Don't force them to eat. It'll only bring them discomfort. So this is really important in terms of when it's really hours away. The skin of the knees and the feet and the hands becomes sort of purplish, pale and grey and blotchy, and these changes signal that death is going to occur within a few hours. So this is really important to understand. Somebody's asked you how do terminally ill patients feel. Well, sadly, I don't know because
you've never been there. Yes.
But in my experience, it's normal to feel, the patient themselves begin to feel shock and sadness, sometimes anger, sometimes in a few situations helplessness, some get agitated. But for some people, the feeling that they're unable to cope with the situation does not go away, and they feel too low to be able to do anything they want to. And if this happens to them, it's good to talk to them. Sometimes, a relaxant, something that helps them calm down is very good. Like I said, there's no such thing as addiction at the end of life. So, when you're preparing for end of life, make sure that the legal things are also important. Zoo, dare I say, and I'm not a lawyer, we often have families fighting after death, preparing.
Yes, there's a lot of that.
Documents, decide the will and the trust, make a list of the assets. I've had so many issues where I as a doctor have got involved in determining, housing plans and final wishes, and sometimes create an obituary or death notice. I mean, this is we just had the Queen die, and I understand that the Queen's death had been rehearsed for the 10 years prior to her death.
Wow.
I mean, absolutely. So everything was actually spot on because they've been planning it for years and years and years now. I don't mean that, but I mean, this is really important in terms of how you help the family of a dying patient, these things are really, really important. Somebody says here, what do you not say to someone who's dying? Well, I guess that's a good question. What not to say to someone who's dying, I think, is don't ask how are you. Don't just focus on their illness and make assumptions. Don't describe them, in my opinion, as dying, and then don't wait for them to ask. Talk to them, because somebody says, can a person who is dying hear you? Well, the important findings, along with observation of long-term end-of-life care, is brain activity actually dies last, and the hearing is probably one of the last things that dies. So they can hear, they may not be able to communicate, but towards the end of life, So what happens is, as the brain is shutting down, they begin to have hallucinations and auditory hallucinations. They hear things, they see things that are not there because the brain is basically shutting down its energy system. So some of the past memories come to them and they look very visual. So they may talk to somebody that's not there. They may hear things that are not there. So this is something that is important. Somebody says here. Gosh, we have lots of questions here. What is a word for comforting somebody who's dying? We have somebody in our family that we feel is close to death, and we want to know what is comforting. Well, I'm sorry to hear that, but I guess, things like, I know this wasn't an easy decision to make.
Yes.
I'm sad, of course, but I'm also glad that you're in a place where you don't have to fight so hard anymore. I'm praying for you to be at peace.
To be free, things like that.
Yeah, so it's really important. Somebody says, can a dying person talk? Of course they can talk, but sometimes...
Sorry, I don't mean to laugh.
They go into withdrawal. Speech becomes slow and conversation difficult. So your loved one may lose the ability to speak altogether, but they can hear what you're saying.
Yes.
So careful what's going on. Somebody's asked here, and these are more sort of spiritual questions that I'm not in a position to answer. Somebody says, what do we read for a dying person? Well, I guess, last acts of kindness, lessons for living, pieces from the Bible, these are things that people
peaceful
want
things,
to hear.
yes.
Absolutely. So it's really important. Actually, one of the most common word is mama, can you believe it or not, is one of the most common words that people speak as they're dying. And it's very rare. I've heard somebody who's on their deathbed said, I wish I'd worked an hour longer. So it's really important to understand
Dr.
that
V.
try to cherish your life. So this is really important in terms of care of the dying.
Dr. B, there's actually a question here that is super weird, but the person says, why are corpses buried facing upwards? This is from Fiona in Maung. Hi, Fiona.
Hi, Fiona. Actually, that's a tradition in the Judeo-Christian. Others are actually buried face down. The Apache Indians in North America, the Icelandic people. Actually,
I never knew that.
Because they're going into the soil, they're going into the earth. So the tradition amongst the Red Indians of North America, or the Native Indians, I should say, were to bury them face down. So this is a Judeo-Christian faith. So it's really just about the culture.
Wow.
Somebody's also asked here, what do people regret most end of life? This was actually supposed to be care of the dying, not regret. But anyway, well, in my very humble opinion and years of life, and this is only n equals 1 of an opinion. Some wish that had been happier and enjoyed more life. Some wish they had lived their dream. Because patients often have talked to us about this. Often the doctor is the last person they see. So some have wished they'd taken better care of themselves. Some had wished, I think, they'd chosen more meaningful work. I can go on and on and on. It's amazing the privilege that we as doctors have. What's the most common regret? I guess the most common regret is actually not being close enough to the family.
Yes.
Is there any harm in giving sleeping tablets or painkillers? No, not at all. If the patient is restless and cannot sleep, a little bit of a sleeping tablet from a doctor is not a bad thing. If they're in pain, you keep upping the dose of the painkiller until they're comfortable. So that's really important to know. Hydration is important to make sure that they're at least getting some fluid into their system, but food is not as important. So this is really important to understand.
And Dr. B, before we shut this down, I wanted to talk about the specialists that are involved in aiding all of this, as well as maybe you explaining that we don't do that euthanasia thing that they do in the Western country. Well, I don't know if we do it here, but if you can maybe separate euthanasia from what we are talking about right now.
That's a very good question, and it is one that is hotly debated, and in some parts of the world, assisted dying, which is what we call euthanasia, where actually the doctor actually assists the patient in an easy transit, is legal now in many parts of the world, and it's a debate that's being held. It's not yet been held on this continent, but I think it must be held because there are situations where the patient is in extreme pain and really miserable, and you really can't bear to see them suffering, and so it is a conversation that I think does need to occur, but it's not legal in this country.
Yes,
the specialists that actually manage this are called palliative care physicians. Palliation means to assist and to comfort, and they are specially trained in terms of care of the dying, in terms of their needs, their wants, their medication, what to cut out, when to call the family in, and they often come home. So they're called palliative care physicians. And in some parts of our country, we have hospice care. Like there's one in Old Naledi, and some of the churches are involved in hospice care, where generally nuns and people of the church actually look after the care of the dying. So these are the people that actually look after. But in our country, often it turns out to be the doctor or nurse within the hospital that looks after them. So we're all trained as clinicians on how to manage these things.
All right. Well, perfect, Dr. B. I really appreciated this conversation because it took me back to, like you said, caring for a very special person in my life. And I hope that we were able to give our friends here some great answers on how to aid themselves and other people as they go to the afterlife.
Indeed.
Yeah.
Next, talking about we're going back to COVID. I want to talk about some of the lessons we'd learned after the COVID pandemic and what tools we can empower ourselves with, having learned from this pandemic and what needs to change in terms of lifestyle.
All right, Dr. B. Well, I cannot wait for that. And yes, next week I will be here.
Sing as a bird. See you next week.
I will. Have a great weekend. I mean, week, yo.